Today we're going to demonstrate a great taping method for pronating or rolling in feet. This is my own modified version of what's called a low dia taping method. I've been using this on patients here for the last 7 years. People with conditions such as plantar fasciitis, heel pain, heel spurs, metatarsalgia and even knee pain can benefit greatly from doing this method. To do it on yourself, you'll need to sit up with your foot relaxed, though it is easier for someone else to do it. To get started, you'll need some 38mm rigid strapping tape and either some skin prep swabs or some Hyperfix or Fixamol underwrap to prevent skin irritation. Okay, firstly we need to prepare the skin. I'm just using some skin prep. This goes underneath wherever there is tape, as to minimise the risk of skin irritation or blistering. You can get these in swabs or in a spray-on. The first strip of tape is the longest strip. We start adjacent to the little toe knuckle on the outside of the foot and wind the tape around the back of the heel up the inside of the foot to finish adjacent to the big toe knuckle. The foot must be relaxed. The tape is not tight. Pat it down so it's firm. This next strip is the most important part of the whole taping. A smaller strip, we start just below the little toe knuckle. You can feel that under the pad of the foot. So I'm anchoring that strip just below that knuckle. What we do, with your thumb, push upwards under the big toe knuckle and gently pull the big toe down towards you. Relax your foot, push, pull, and then gently just wind the tape underneath there. Again, the tape's not tight. Now we overlap that tape with a second strip, just by about half. And we'll do that again. For a bigger foot, you might do 4 of these strips. Normally you'd only need 3. And that's fine, up toward the heel, but not over the heel. If you're using 25mm tape, you will need 4 strips. Now we're preparing to seal off the tape. It's basically the same way we started, a longer strip starting adjacent to the little toe knuckle, winding around the back of the heel. Don't pull it tight, firmly but not tight, then just up toward the big toe. It can finish on the big toe knuckle or just below it where I am there. And you can see this taping, it doesn't sit on the ball of the foot, it sits just below it. Now we need to finish this off in standing. Okay, this last step we need to do in standing. It's important the weight is getting pushed through the taping when we're doing it. The smaller strip is going to go over the top of the foot. Firstly, just peel back this layer of tape so that it loosens it around the big toe knuckle and replace it there. Place the other strip over the top to seal it in place. You need to take a few steps around the room to make sure that it's comfortable. If it's still tight around that knuckle, just redo that last step.